Welcome to Center of Balance Live. I'm Szenan-Balance from Center of Balance, the acupuncturist. Now, today we're going to talk about endometriosis. We're going to talk about the 6 risk factor for endometriosis. Right. If you are on live right now, watching this live video, please give me a thumbs up first. Then talk to me, put some comment in, leave some comment and let me know where you come from. Are you an acupuncturist? If you're any acupuncturist, please reply 1. If you're not an acupuncturist, reply 2. Then the last thing I want you to do is just simply share this video. If you're on YouTube or Instagram, please click share this live video. So let your friend, your family know that you're watching this live video every day. So I want to encourage more and more people and come and join us and to get the information for health, right? Today's topic is the 6 factor risk factor for endometriosis. Now, a lot of people suffer with endometriosis, but there are people that are not sure about what is endometriosis. We're going to talk about it. Right? Hi, Kika. How are you? Hey. My camera. I set my camera differently right now. Today I'm sitting down, so normally I'm just standing up. I have to stand up and reach to the camera. All right. Okay, let's start. Hi, Rajit from India. Nice to meet you. And yeah, and if you're on Facebook, please, because I don't know why sometimes I couldn't see who you are on Facebook, and you have to say hello to me to be able to show you up, and then I know who you are on Facebook, and just say hello to me. Yeah, it's morning now. It's 7:35 p.m. a.m. Sorry, a.m. p.m. Yeah, it's in the morning at the moment. It's getting cold in here. It's getting cold. All right. Hi, happy day. How are you? So we talk about endometriosis. All right. So what is endometriosis? Endometriosis is a condition in which tissues similar to that which normally forms inside the uterus grows in other places throughout the body, most commonly in the pelvic area. Right. What that means is the tissue that grow in the uterus and not supposed to be growing on other places, but in this case, it does. So the tissue is supposed to only grows in the uterus, but it grow on other places. Right? It can grow in any other body. Think about it. The the tissues in the uterus, it has a cycle that every month when you have a period, and if the blood doesn't come up properly, the flow is not good, and you start to get pain. So if that tissue grow in your nose, then you get nosebleed and pain in the nose, and that happened. We've seen this case, not in New Zealand, funny, it's actually in China. Yeah, the patient that every month when they got their period, they get nose bleeding. Yeah, okay, and most happen endometriosis. It actually happened in the pelvis, which is outside of the uterus. All right, so it's painful. It causes painful, and it can grow in the intestine. It can grow on the bladder. Yeah, because they are pretty close together. Right? It can grow to anything around the navels. Yeah. The symptoms of an endometriosis vary from people to people. Some people with endometriosis have tremendous pain and reduce quality of life, while others have no symptom at all. For those who have no symptom from endometriosis, we call it silent, the silent one, because endometriosis, it normally causes a lot of pain for patient. Okay, and this pain is very annoying, especially when you have your menstruation, while bleeding, and that is the most pain. But they are patients that actually get pain out of the menstruation bleeding period. All right. So if you got and it can, and one of the common things that I've seen a lot in my clinic is when they come, they complain about the bowel motion, the stomach pain, and the stomach pain could be up in here, like belly button, not just in here, aching up in here. And what it caused diarrhea. It caused diarrhea, and what else? It actually caused diarrhea as well as constipation, like in between. So what is the similar idea in your mind when you see, oh, sometimes diarrhea and sometimes constipation? Yes, IBS. Yes, a lot of patients actually been misdiagnosed IBS because it's simple. It's easier to diagnose IBS than endometriosis. Why is that? Yeah. Why is that? My friend Kika said my friend has endometriosis, but doctors said it nothing special. Is there any supplement for this odd measures? Yeah. You know why? The doctors say it's nothing special because a lot of people suffer from it. And secondly, the doctor don't know where it come from. So therefore, they don't have a better idea or any good treatment for it. The only treatment for it is the only treatment is surgery. Yeah, remove the tissue on the pelvic area if the tissue grow on the pelvic area. Yeah, so but unfortunately, when you remove the tissue around all the surgery, that's the only one they do. There's nothing they can do. But we need to know that the endometriosis is it has been formed is if you don't know the cause of it, you don't know how to treat it. But you simply just remove the tissues, and it will grow back. All right. Is this endometriosis dangerous? No. It won't form to cancer or anything now. But people realize right now that a lot of cases for endometriosis is because it is one of the biggest reason to cause infertility. Yeah, one of the biggest issues to cause infertility. So in between 20 and 30 years old, a lot of people try to a female, they try to have a family and try to prepare for conceive, but unfortunately, hi Joanna, how are you? Unfortunately, Sneezamilo 62, how are you? Thank you for joining us for our live video today. Our topics actually we talk about endometriosis. It's 6 risk factor for endometriosis. Hi Irina, how are you? Just say hello. I have to reach over to the camera to say hello because it's quite far away from me today. I changed the structure of my office. I sit on a table. I changed the table. My table used to just so close to the wall, and now I put it in the middle. So my camera is actually I have to reach over to the table to be able to reach the camera. You have Serbian friends? Yes, I have Serbian friends. Great. I'm glad that you're fine. Good. We're talking about the 6 risk factor for endometriosis. Okay, I have a lot of Indian friends as well on YouTube. Actually, what's the Facebook channel? Raji, the Facebook channel, you can check down there in the description area. You can go there, and there are link to Facebook channel, Facebook page. Just click the link and you join our Facebook channel. Oh, I'm sorry. Probably the link will be in my clinic one. If you search Center of Balance, I'll keep in mind. I'll put the link to get put it next time. Because the link on the Facebook and YouTube is mainly for practitioner, but I actually do this video every morning, live video for my clinic for my patient, to get some information to my patient, so to let them know what is disease and common disease that happen and what they can do about it. All right. Now, endometriosis affects more than 11% of women, like in the United States, and between 15 to 44. Okay, so this endometriosis only happen when you you start to get menstruation. But for those female, they haven't got period yet, and they won't have any problem. There is no diagnosis for as far as I know, there's no diagnosis of any case that female that they haven't got any period and been diagnosed with endometriosis. Okay. So while it can happen to any female who have begun having a period, they are risk factor that increase your chance of developing these conditions. So today, our mission is mainly talking about what are the risk factors that increase your chance of developing these conditions. All right, it actually is from the Western side, but I will talk about what I think in the Chinese medicine, according to Chinese medicine. Okay. Let's talk about one factor in Chinese medicine first. The real in Chinese medicine, we talk about that causing any kind of disease is actually, well, one of the bigger issues is the emotion. We call qi qing. Okay, 7 different emotion. So each organ, when it's out of balance, it causes different emotion problem. Okay, let's talk about heart. When heart out of balance, you're not heart control joint. When heart function is strong, and you'll be able to enjoy anything, anything. But since if you find that there's no joy in your life, that means your heart function start getting low. So what heart control? Heart actually control the blood circulation, right? According to Chinese medicine, in Western medicine too, it control the circulation. Now, if circulation getting less and less and less, then the blood flow will slow down. Right? When the blood flow slow down, and even though in some area it stopped, and that is what is causing pain. So that explains an endometriosis the main symptom for endometriosis is pain conditions. Pain conditions, right? So it related to the heart as well, right? Then for spleen and stomach, spleen and stomach, spleen and stomach control the thinking. So when you think, if you think too much, if you're working too much, and it always use your brain, and if you need to think too much, it actually harm your spleen and stomach. Yeah. So think about if you too focus on something, that happened to a lot of people, including me. If I'm thinking, focus on something at work, and I keep thinking, and then I actually lost my appetite. I don't feel hungry, and a lot of people have this way, and this is how Chinese medicine discover or link to. It's pretty easy to understand that someone is being linked to thinking. Oh, okay. When the emotion, if the spleen and stomach out of balance, and it will develop anxiety. People get worried a lot, and people start to get anxious. Right? This is linked to stomach and spleen. Now, and of course, it will come with the symptom of overthinking is not good. Bit hard to stop. Yes, how to stop it? Good question. I suggest Ho'oponopono method, and they we can talk about in the future about the anxiety and what are the tools that we can do for um, anxiety. Yeah, it helps. Okay. Now, of course, if you find that Tai Chi exercise or singing, listen to the music, meditation, yoga, it helps. If that helps, if you practice it and it helps, and I will encourage you. This is the tool that you have found it. So please just go for it and keep it in a routine every day, because it'll help you clear your mind. So you won't overthinking about it. So this is important. We need a solution. Something that you can change it. Like personality thing is difficult. It's difficult to get over it and to change it the other way to the other way. But you need to practice. You need to have a solution to try your best to go through it, and you get better and better, right? And especially when we can't control that thing happen. A lot of things happen, and you start to get worried, and you really need to ask yourself, why do I get worried? Okay. And you really need to ask yourself, does it help if I worry about it? If it's not, I find that people get worried is because they have no solution, or they don't know about the outcome. They don't know about the outcome. If you know the outcome, you won't worry about it, because you need to ask the question. You need to be positive, like everyone face a lot of problems. Like I do too. Okay. So if you look at this problem and you ask yourself, do I have any solution? No. Okay. I don't have solution right now. So what can I do right now? No, nothing you can do. If that is so bad, nothing you can do. Okay. Now you need to have a solution. My solution is Ho'oponopono method. That Ho'oponopono method, there's a book called Zero Limits. I talk about Ho'oponopono method. It changed the energy around you. It changed the energy for the bad thing, right? It changed the bad energy to the positive energy. It clear up all your mind. It's simple. You just need to repeat, I'm sorry, please forgive me, thank you, and I love you. Simple, right? So you can repeat if anything that worry you, and you just go over and over in your mind, or you can sing it, you can say it right down, just repeat it or repeat it. I'm sorry, please forgive me, thank you, and I love you. I'm sorry, please forgive me, thank you, and I love you. Okay, that is the back sense of it. We will talk about in the future, but it's simple. I just introduced to you right now. If you have anxiety, emotional problem, or any pain at all, just repeat this, because it works for me. It works for a lot of my patients, and I have amazing story to share with you next time about my patient. And I don't think that the family relationship problem, the anger, anxiety in the family, and depression, and and she came to me, and I give them acupuncture, and the family, all family happy, and 4 years of not seeing family, and they get back together, and what happened is she practiced Ho'oponopono method. Yeah, and the beautiful things happen in the family. Is Tai Chi for younger? I want to try, but everyone say no, you are not grandma. No, Tai Chi for everyone. So Tai Chi is got the theory of Tai Chi is amazing. Okay, it's talk about yin yang. It's just Chinese medicine theory and Tai Chi. Chinese medicine theory and Tai Chi. A slow move, a slow move. But it's for everyone. Yes, it's for everyone. It's not for elderly patient only. Okay. Now your friend, people talk to you about that, and they surely they don't know anything about Tai Chi. They don't know anything about Tai Chi. But let's get back to endometriosis. So the number one risk factor is family history. So if someone in your family has endometriosis, your risk of developing it is 7 to 10 times higher than those who know family history of the conditions. Right? Endometriosis in immediate family members, such as young mother, grandmother, or sister, puts you at the higher risk for developing the conditions. Now, if you have a distant relative, such as a cousin who have it, this also increase your chance of being diagnosed. Right? Endometriosis can be passed down from both your father and mother, which means your father won't be having endometriosis, but if your father's sister, or if your cousin from your father's side, or you will think about mainly from the mother's side, right? But no, not really. In reality, actually, from the father's side as well. So that makes you think again. I'm gonna tell you again one thing: if anything that from your family, anything that's unclear, the disease unclear, and they tell you it's actually from your family, or actually from your a genetic problem, hey, it actually just telling you that they are not sure what's causing it. But in reality, what we put it down, according to Chinese medicine, is a diet habit. It's the emotion. It's the how you react to the things. I'll repeat it again. You probably know about it. I always talk about this. Is when you love something and food, like if you love salty food, you love salty food in your family, that's because your dad or your mom, they cook it that way, and they put a lot of salt. That encouraged you. You've been educated that way, that salty is yummy. Salty is yummy. And to be honest, if you want to, like my dad, I love a bit salty, but not too salty. And my dad loves salty food, When he cook, oh, I can't bear it. It's too salty. I always say too salty. And why is too salty for my father? Because he was a smoker. when you smoke, your taste in your mouth, in your tongue, it get less and less sensitive, and they need to put, to stimulate their appetite, they need salt to feel, to taste the food. They need to put a lot of salt. I remember when I was young, and whenever my dad cooked, and was like, wow, this is too salty. I always complain about too salty, and my brother and sister, and my mom cook and my sister cook, and my dad always get soy sauce and to add more on the food for himself, because he want more salty taste, So, but luckily we realized that too salty is not good, so we try to avoid those. All right. So again, if your family, like my family, like I can see that my brother, they love a bit salty too. This is run in the family. If we all love salty food, of course we will develop with what? Maybe high blood pressure. Because high blood pressure is directly linked to salt. Okay, so this is family thing. Like, if your mother or father, when things happen, if your father get angry easily, always when things happen that they can't solve, they get angry, then you learn from your father. When things happen, you get angry too. When you don't have a solution. Now, all your mother, when things happen, they worry, they panic, and you see, when things happen, this is the right reaction for things happening when you have no solution, and you learn from your father and mother, and that is where you get all the similar disease in the family. Okay. Hi, Samu. Samu, nice to meet you. So this is one of the factor for family history. Okay, menstrual cycle characteristic. The more exposed you have to menstruation, the higher the chance you have of developing endometriosis. Factors that increase your menstrual exposure, that includes in here, having 27 days of fever between each period, right? So which means if normally the normal standard of period is 28 days. If your period getting less on the cycle is 25, sometimes 27, then sometimes just 22. So shorter period cycle between your period, that has to do with the endometriosis. It's easier to develop. Okay, starting your first period before the age of 12. Okay, I want to tell you, in the old time, the real one, people get female younger get period right now. Why do they get period early? You need to think about those. A lot of people get period when they're 8, 10, or 11, right? 8, 10, 11, too early. Even 12 years, too early. The proper one should be 14. You probably ask your mother will be still 11 or 12, But if you go back to China, now they do 12 or 8 years old, because they have a lot of KFC, they have a lot of meat, and they're full of the drugs in it, antibiotics, and as well as the steroid in the meat, So that causing that stimulate the period come early, and that's not good. Okay, in the past it should be 14 years old, 15 years old they start to get period. Right, that is normal. Okay, experiencing period the last 7 that lasts 7 days or longer each month, which means you're bleeding. Your bleeding lasts for more than 5 days, 7 days, 8 days, 10 days, longer period, and that's easier to develop endometriosis. Okay, now pregnancy. Okay, it's good though. If you get pregnant, it actually reduce the symptoms because the hormone change, and that stop your period. When they stop your period, you decrease the risk and you decrease the symptoms. Okay, but you may still get some symptom pain if the symptom happen not just during your period, not just when you have your period. Then you may have some symptom discomfort in your tummy, in the pelvic area while you're pregnant. Okay, but unfortunately, when you give birth, right, after birth, and the symptom came back again, endometriosis. That's why I said earlier, when you on the Western side, the only uh, solution for endometriosis is surgery, remove the tissue. Okay, but you take a risk. Think about how many times can you do the surgery, because all surgery form scar tissue. Hi Amida. Hi Aaron. So when it forms scar tissue, and that cause pain as well. Okay, so I have patients who have several endometriosis surgery, and in the end, the doctor told them that, hey, you can't do any surgery anymore. Why is that? Because they are bless me. Bless me. Because the patient after surgery, the symptoms no change, which means the pain still the same, and the diarrhea, tummy problem still the same. Although they found out that the scar tissue developed in the tummy, they normally feel fine in the beginning, you know. So some of them, after a few months, they start to get the symptom back again. And so the doctor actually refused surgery for them. It's a real case in my clinic. Okay, so I want to tell you that surgery should be the last option. But if you want to get pregnant, okay, and then surgery, it may be a good option for you. Why is that? Because in our treatment of infertility, we found that when patients go for surgery for endometriosis, they remove the tissues, they actually help them get pregnant easily. You know, why is that? Because endometriosis prevents them to get pregnant. And according to Chinese medicine, there are a lot of blockage in the pelvic area. Then if you remove all this, and you actually get pregnant easily. This is truth. We've seen a lot of patients happen in that. But regarding of infertility, if patient, if the female plan to go for surgery for endometriosis, we want to make sure that the man, the husband, has a sperm test that is normal, because the higher your chance to increase the chance to get pregnant, remove the endometriosis, it actually help, it increase the chance. But if the partner, husband, has low sperm and low motility, all this thing, and actually you didn't help it, you actually didn't get the chance to increase the pregnancy, you know. That's you, Irina say. Kika say yes, but what alternative we can use instead of surgery? Yeah, acupuncture and Chinese medicines. and changing your diet, it can help. I have patients who who still come to me. It's been for about a year now, and I'm going to see her today actually. We started acupuncture 3 times weekly. She had endo. Endo means endometriosis, okay? And she had surgery, but the pain started to develop again, okay? And she was worried. She didn't want to go for surgery, and she understands the endo go back again. So she want to prevent it. So I asked her to change the diet. Then for acupuncture, and her pain is not just come when she got her period. It actually for any time in the cycle that she got it too. So we started doing acupuncture, and she started get better and better and better. And guess what? She has the similar symptom condition with IBS, which is loose bowel motion and constipation and stomach pain, bloating, and lower back pain, all this thing. Then we started with acupuncture and then Chinese herbs, and now we cut down her treatment slowly, dropped down to one acupuncture every 2 weeks, from 3 times weekly, from one acupuncture every 2 weeks, and herbs once a week. No, herbs weekly, start weekly, then drop down to herbs for 1 week, stop herbs, and take another week. And now her plan is on just come once acupuncture monthly, and just take 1 week of herbs and stop for 3 weeks and start 1 week again. So I slowly weigh off the acupuncture treatment and Chinese herbs treatment. The reason we do this is because her symptoms getting better and better, and she no longer feel any pain in the tummy. For instance, sometimes she still feel it. It's just tingling, sharp, in one side of the tummy, and it doesn't last. It just for few minutes and it went away. That's why we cut it down slowly. And the symptoms still there, so I asked her to do some acupressure point. Yeah. So all my patients, I actually tell them, hey, if you want to get better, you want to see a good results, and you want to speed up the results, or you want to maintain the results, there's something that you can do, acupressure point. And for the acupressure point, I asked her to do this over here. Okay, acupressure point over here and over here, right? So you have to over here. You have to dig deeper to get to the point, and do it every day and remove all the tension over here. And when she felt the pain, she go ahead and do all this acupressure point and dig it deeper, and actually instantly relieve the pain, the sharp pain in the tummy, right? So let's keep going. We're gonna talk about the 6 different factor. You're welcome, Kika. The 6 different factor for endometriosis, right? And we go to number 3 now. Condition that interfere with normal menstrual flow. Okay, one of the theories of causes associated with endometriosis is retrograde menstrual flow. Okay, or the flow that move backward. Right. If you have a medical condition that increase, block, or redirect your menstrual flow, this could be the risk factor. Okay, what that means is we know that when you have a period bleeding, the bleeding is actually from the uterus to your cervix and to vagina and pass out to your body, right? If any disease that actually causing the blood go backward. It's not going not passing out your body properly, right? It's going backward, and that causes endometriosis, right? What is the so the condition that can result in backward the menstrual flow that include the increased estrogen productions. So in your body, if the estrogens increasing, so what is estrogens? Estrogens is actually for high alali. I speak you. Estrogens is actually in your body. It develop producing the estrogen is for stimulate your uterus to form lining, to form the lining, uterine lining, right? And when you get your period, is which means every month you're not getting pregnant, then the lining, uterine lining, fall off, and it become blood. So the uterine lining is actually built up from blood, and it can't go without estrogen, because estrogen is helping the blood turn to the lining and to build up the lining in your uterus, and that is important if you're trying to get pregnant. You need to understand this, because this lining is where when the sperm and eggs meet together, it become embryo, and the embryo need to implant, and it need the lining, thick enough lining to be able to implant properly. All right, so this is it. So so if the estrogen is very high, and that stop your period, or if the estrogen is very high that you can't pass out the lining, the bleeding properly, and remain in your uterus, and that cause endometriosis. Okay. Hi, MLCA. Nice to meet you. Thank you for coming out, joining us our live video. And today we're talking about endometriosis, the 6 factor for endometriosis. So uterine growth, like fibroid, right? If you got fibroid in the uterus and your bleeding can't come out properly, and some of them remain in there, or it get backward, right? Instead of going forward, it get backward, and that is one of the factors for endometriosis developing. Okay, it's an abnormal structure of your uterus, cervix, or vagina, which means you're born that way. So if you're born that way, your uterus structure is abnormal. It doesn't help the bleeding passing out, and the vagina and the cervix as well. They have an abdominal shape. Then the blood can pass out properly, and it remain in there, or it went backward, and that's how it causing one of the reason it causes endometriosis. Let's talk about number 4. The 4 reasons. The factor, risk factor, is actually the immune system disorder, and that happen a lot. Okay, so immune system disorder contribute to endometriosis risk. Okay, if your immune system is weak, it's less likely to recognize misplaced endometrial tissues. The scattered endometrial tissue is left to implant in the wrong place. It can lead to a problem like inflammation or scarring. Hi, KR7808 SARC 15. I don't know what the account name means, but thank you for joining us for our topic today, the 6 risk factor for endometriosis. Okay, we have more people. For Eric, nice to meet you, Eric. Endo pain, PC 7.5. Good one. Good point for it. Yeah, very good point for it. Eric, thank you. Okay. All right. So yes, immune system power. Now, we know the immune system is when you have a good immune system, when there is things that in the outside that it come to your body, like virus, bacteria that's grow in your body, and you can detect it. And when you detect it, your body, the immune system, it can balance it out. It can help to take care of it, to solve this problem. So the virus or the bacteria will be fine. It will take care of it. It can remove it, pass out of the body. Same as here. Is any misplaced endometriosis, endometrial tissues that misplaced in different organ, different place, then if you have the good immune system, and the immune system will detect it and just resolve it or pass it out to your body, then you'll be fine, right? But if you have low immune system, people get flu a lot, and I don't know whether about you experience this or not, okay? And woman, when you have your period, and if you got a flu, a cold, and your period just suddenly stop, it just stop. That's because when you get a flu, get a cold, common cold, and your immune system mainly go and detect and protect your body to open up and actually try to fight with the bacteria or virus, then your period stop. Okay, we have a formula for this, 小柴胡糖 in Chinese medicines. Can you maybe show us acupressure point for painful menstruation? Yes, I will. Yes. Can endo disappear just like that? No, it's just beginning of endo. We're talking about the tissue, Yes, flu can stop period. Not for everyone, but common, very common. You have your period. While you have a period and you catch a cold, and you find that, your period shorter. It's shorter your period. You normally have 5 days and it becomes 3 days. Or the amount of bleeding getting less and less. All right. Yeah. Yes, menstruation pain, Arena is over here. Okay. Over here, you have to dig very deep. I suggest you use your knuckle and press over here, this area. Press it over here. So this area over here, if we look at here, we know that whether you develop any fibroid or PCOS or endometriosis, palm reading. So our palm reading is different. Okay, we're not talking about our palm reading. Oh, you're gonna be rich. You're gonna be how long you're gonna live like this. We don't talk about this. We are palm reading. We should say palm reading. I put it down as functional organs palm diagnose. We use palm to diagnose. So this area is actually your uterus area. So you can press over here. All right, press over here. Okay. Apart from here, there's another point over here that works very well. So it's in the inside of your ankle bone. What is the inside? Inside is the toes. Okay, this is toes inside, and this is the outside. Little toes is outside. The inside of the ankle bone, forefinger above the ankle bone, and right behind the shin bone, and the edges. And you press, and you get the sensitive point, and you press the sensitive point over there. If you have period pain, you press the point, it gives you instant relief. Same over here. similar to here. Okay, this is difficult to press because you have to press it very deep. You have to press it very deep, but it's easier. You don't have to go to your feet. You know, you can just standing. You know, whatever you do, you just go. It's easier to access to on your hand rather than your feet. But feet, it's easier to press. You don't have to press that hard, and always very sensitive. Here, you need to press very hard to get to a sensitive point. Okay, that's the difference between them. Right? I'm saying that if, like, let's say the immune system disorder is a bit similar to the abdominal surgery. Okay, if you go for surgery, okay, and like what kind of surgery? C-section. I don't know where you're familiar with C-section. Is cesareans. Okay, cesareans, or the surgery of the what they call hysterectomy. Okay, hysterectomy. When they surgery, because they are touching the endometrial tissues, you know, and remove them. So this remove is all bloody, you know, and you may drop some blood in other organs, other tissues, and those tissues, the blood contain the tissue from your uterus, and it plays on different organ, and that it will develop in the future. So that is another reason that it causes we cause that is replanting the tissues. Just like you move the plant from here to the others, you know, but you don't do it purposely, but it happened when during the abdominal surgery, hysterectomy, and you take it out and it dropped to other organs. Okay, and it put it in there and it grow afterward. Okay, but again, if it's this cases, if your immune system are strong, you know, when it start to grow, and your immune system is strong, and it will attack this area and put it to normal. You know, it all depends on whether you have a good immune system or not, or not. All right. So it's the 4 and 5 factor is pretty similar. It's just beginning, the misplace of the endo tissue, right? Okay. The age. The last one is the age. All right. So unfortunately, this disease is not about when you're getting older, you develop it. No, it's actually more in the young lady, you know, young female. Okay, so endometriosis involve uterine lining cells. Okay, so any woman or girl old enough to menstruate can develop the conditions. Unfortunately, okay, endometriosis is most commonly diagnosed in women in their 20th and 30th. I mentioned it before. Why is that? Because in this time, more and more people diagnose about it. It's because they try to get pregnant. And when they try to get pregnant and they realize, oh, I can't get pregnant, you know, then they go, some of them have symptoms, some of them have no symptom. Okay, when it comes to infertility, to be honest, in Chinese medicine, is we just get to put your period back to normal. What is normal period? Normal period is about 28 days. Okay, it can be 30 days, the cycle, and then every cycle you get regular bleeding, like about 5 days or 4 days, and the bleeding is about you're changing the pad for every 2 or 3 hours. Okay, and that's normal. And more importantly, no pain. You can't feel any tenderness in your breast. Okay, those are very important. And no emotional, like mood swing. You know, so though anything that happened with pain or moody, or breast tenderness, they are abnormal. Okay, they are not good, right? So this is abnormal. Do not think that those things are normal. Okay. In Chinese medicine, we try to decrease all those things. When it become more normal, no symptom while you have a period, then you increase your chance to get pregnant. That's how we do it. Okay, and to be honest, some of them, they are pretty good. Like I said, silent endometriosis. The only way to diagnose it, and what we do for fertility patients, and we get them to check all the blood tests. Yes, that's impossible. Every girl has symptoms. That's right, Kika. You said that's impossible. That is possible. That's because too many people now, they don't look after themselves, and what happened is that's possible because I see someone that no symptom at all, and that's because you're in the wrong diet first thing, and a lot of people have cold drink, in your period or lead up to your period. Why cold not good? Okay, and the Chinese medicine, we think that the cold is to do with any pain, and the cold is to do with endometriosis as well. So you try it. I have patients, we ask them to stop cold ice cream, especially lead up to period or while your period. Okay, you find out if you drink cold thing, ice cream, when you lead up to your period or while your period, you drink it, you get pain, or your bleeding getting less and less and less. That's very common. A lot of people have it, right? So, and you try it out. If you have a period, you put a heat pack on your tummy, and it helps your pain. Why is that? Because more circulation and heat in your abdominal, it removes the coldness out there, and you feel better. And if you put heat pack in your abdominal, you find that, oh, your bleeding increase. It's much easier. Sorry to disturb, but my friend has learned that her egg cell are not enough good after second VTO. What is VTO? Is there any treatment in Chinese medicine for it? Yes. We have treatment for that. When the egg cell is not good, which means it's the kidney problem. In general, it's kidney problem. Yes, I put hot water to my tummy, and you feel better with that, right? Okay. I think we just need to close down now. The Instagram is about an hour again, so at about 1.5 minutes, it's going to close down. So to reducing the risk, artificial pregnancy. Oh, okay, IVF. I think it's IVF. What do you mean? Okay, IVF. Yeah. There's a big topic in IVF in fertility. Yeah, in fertility. Hi, Sija. See, okay. Now we talk about how to reduce the risk. Okay, reduce the risk to exercise regular, eat whole food and less processed food. That's good. In my opinion, no processed food is better. Whole natural food, or consume less alcohol. In my opinion, no alcohol is better. Okay. Reduce your caffeine intake. In my opinion, no caffeine intake. Right. Talk to your doctor about your birth control medication to see if there is a type you can switch to the contains less estrogen. In my opinion, no control birth medication. They are so bad. Okay, so if you search online, you see all the control birth medication. They are actually making you sick. You know, they are controlling you, putting the artificial drugs and hormone in your body that change your body cycle, and that is what causing endometriosis, one of the factor as well. Okay, but they don't talk about it. To be honest, no one talk about this. Yeah, because they don't want you to know. Okay, I'll see you next time. Bye bye. So the Instagram's off. Okay. Okay. All right. Yeah, I reopen the Instagram again because it just cut it off itself. So the takeaway, so knowing the risk factor for endometriosis can help you to manage your health. Yeah, not only does this information supply you with effective risk reduction strategies, but it can also help your doctor arrive at more accurate diagnosis. Okay, since endometriosis is easily misdiagnosed, yeah, we talk about it's easy to misdiagnose with what? With IBS, you know, the most common thing that can misdiagnose with IBS symptoms. Because with the pain, the diarrhea, hi Kika, hi Arena, we started again. It's just a little bit we can talk because Instagram allow us just do one hour. So I think I always go over 1 hour. Okay. So since endometriosis is easily misdiagnosed, so identifying your risk factor for this conditions can narrow down your search for the cause of your symptom, right? So which to be honest, unless you have the symptoms, okay, when you have the symptom and you really need to go and see what's going on and how to diagnose it properly. But if it's come to silent one, the only diagnose to go in it, you know, even in Chinese medicine, even acupuncturists in Chinese herbalists, I do agree with the diagnose with surgery. They just put keyhole surgery into your body and to check whether there's endo or not. Okay, that's the only way. That's the only way, you know, because they are patient with endometriosis and they can't pregnant, and we treat them and the period's all good, everything's all good, but they're still not happening with pregnancy, not be able to get pregnant. And I actually literally asked them to go for keyhole surgery to check whether there's any endometriosis. You know, some of them came out, yes, they do have a silent endometriosis. Okay. Can you suggest supplement? Maybe magnesium is good for that? No, no, Kika, no. I don't agree with supplement, to be honest. I stick with one thing, okay? If you eat healthy, everything can get from your food. Yeah, everything. All the supplement, all the nutrients, all the vitamin C, mineral can get from your food. Okay, so eat whole food, eat greens, you know, eat natural food, not processed one, and you can everything from your food. Okay. Now I know people say that magnesium is a good thing that help them to get less cramp and help them sleep well. It does. It does. You know, it does. I have no doubt of it. Okay, because patient try it and it helped. It helped, right? You, I do agree with that, right? But why we want to ask this question? Like I want to ask my patient, take my herb for the rest of your life. You know, I always ask my patient, I'm going to lead you to some way, bring your health to some way, then you're going to carry on with your lifestyle. You know, you need to change your lifestyle. When you have a disease, you know, you need to check, you take responsibility for it, right? You need to understand where it comes from. If magnesium can help you, you know, that's good. You know, for now, you take magnesium and you need to ask yourself, why you lack of magnesium. Why are you? Where is magnesium come from? You need to find out the answer. Then you'll be able to put the magnesium, get the magnesium from your food rather than supplement. Any supplement that into your body that can harm your body. Remember this. Remember this. The only thing that can harm you is the natural food, the whole food. That I'm not 100% saying that all the natural food can harm you. Obviously, when we eat, we give you a story. One of the patients came for IBS, and she asked for herbs and acupuncture. She was still, acupuncture with other acupuncturists, but the acupuncturist retired and referred to me. So I started to do acupuncture in Chinese herbs for her. And she purposely asked for Chinese herbs because she felt that she got a lot of benefit from acupuncture and she wanted to try Chinese herbs. I said, oh, that's great. That's good. Yes, I asked my doctor. He said if you want magnesium, you need to eat 1 kg old banana dairy. By saying that of your doctor, okay, it's very irresponsible. It's a crap answer for you, okay? I'm sorry that your doctor said that, okay? For me, it's not very professional to say that. Yes, you want to get enough magnesium, you need to eat 1 kg old banana. That's not true. That's not true, okay? That's not true. You think about it, is it true? But what about the others? And how many magnesium do you actually need? You need to find it out, right? But we'll talk about magnesium next time to you, okay? We'll talk about this, okay? And because I do have a lot of patients taking magnesium, and I ask them a lot of questions. By letting them realize that how to change their lifestyle instead of taking. It's too easy to take something, Yes, even I know there's no truth. Yeah, because you see, I don't take magnesium and I'm fine with my sleeping and I don't have cramp, So why do you need to take magnesium? And think about it. You're probably not sleeping well since few months ago or last year. And what about the year before? Why could you sleep well? And why didn't you get lack of magnesium before that? And tell me, do they take any people put on magnesium? They just simply go and buy the magnesium. Do they actually run any test for you and tell you you have lack of magnesium? That's my question. Right? Most people know they don't run any tests. They just take magnesium and tell that, hey, yep, magnesium help, right? So that you lack of magnesium. That's it. All right. Right. Okay. Now, with a diagnose comes solutions. So discuss your risk factor to endometriosis endo with your doctor. So is sometimes okay. So it's important. Endo. I've given you some risks. I do agree with those risks, but the family issues history, I do agree with that, but more in the diet and emotion, how you react to things happening. The menstrual cycle, yes, I do agree with that. And if your menstrual cycle taking about very short or longer bleeding, and that I do agree with that. And condition that interfere with normal menstrual flow, and I do agree with that as well. And like anything that can back with your period, bleeding, and that can cause endo. Okay, immune system disorder and abdominal surgery, and yes, I do agree with those as well. And the age, yes, the age is one more thing. And I also mentioned about the risk factor is the diet, the cold. You eat a lot cold. Yeah, no test. I know, no test. They just simply ask you to take it. Okay, they don't talk about the test. So yeah, we talk about next time about magnesium. Yeah, cold. Avoid cold. Taking cold drinks, keep warm, uh, lead to your period while your period bleeding. Those are very, very important. There's one of the bigger reasons that in Chinese medicine we discussed that develop endometriosis. All right, and PCOS to get you pain or the sting because of when you feel cold, your uterus actually contract and your muscle contract and it can't pass out. It hold the blood inside. It doesn't actually pass out the bleeding properly, and that's what is causing all the woman problem. Right? I have a colleague who write a book about period, right? How to regulate period. They talk about Chinese medicine wheels, and it talk about the pill, the contraception pill. How bad are they? And she actually help patient to stop all the medication and bring the period back to normal and to help them get pregnant. Hi, my name is Ahmed. I'm watching you from Florida. Okay, I was wondering if you can do a video on gout on the bottom of your foot. I want to know where the pressure point is to relieve the inflammation. Hi, Ahmed. I actually have done the gout video already. It's on my YouTube. You're on my YouTube. Please go ahead and find the video, okay, and watch it, okay. If you watch it, if you have any question for that, yeah, I'm happy to do another one for you. I've done the gout video already. Yeah, okay. Stay awesome. Thank you very much. All right. That's it for today, and thank you for joining me for today's live video, and I'll see you tomorrow morning. Okay, tomorrow morning is Sunday. Sunday over here. It's Saturday today. So what we do normally, what I do for Sunday, I go to the temple. All right, but the workshop I go to workshop in temple, but it's not happening yet because of the coronavirus over here. We are level 2, so level 2 we can't when we meet up people, it has to be less than 10 people. Obviously, when we go to temple, it's more than 10 people, so it's not starting yet. So I won't be able to go to the temple tomorrow. So I'll still doing the live video for everyone. But when the temple time start, I won't be able to do the live video on Sunday. Probably I maybe will do it, but just do it much earlier and just keep it short. Okay, to see everyone. Just keep my promise to see you guys on live every day and to give you some information. And we can talk about Chinese herbs. We have a lot of topic about it. Okay, and if you're on my Facebook, and I just upload a video on my YouTube as well. No, on my YouTube and Instagram, not on my Facebook yet. I upload a video about how I do a magic trick with my daughter. We just enjoy our life here and do some vlog video, just for fun and for laughing. So remember, laughing. Is one of the greatest medicines that you can get. So laughing every day, and even though you're in pain, you feel nothing. It's not a big deal. Okay. So laughing is one of the greatest medicine in your for us. Okay, for everyone. So Yes, banana, great video. Yes, great. Have you seen the Kika? That's great. Yeah, the banana one. Yeah, it's a good trick. Okay, I learned it on YouTube actually, and I just play with my daughter. So it's just a fun thing, and you can play with your family too. You know, it's just something trick, and then I find that when people look at trick, magic trick, we always happy. You confuse, oh, amazing, and you always laugh about this thing. Just create some fun in your family and for your friends. Okay, I'm trying to create this fun things in my family for my daughter, and I'm trying to share this with you because sharing with your fun thing and make you laugh is, I think, is my responsibility. Because talking about disease is sad. It's so sad talking about disease because all this is painful, and people suffering. So I think, oh, okay, if I keep talking about disease and that's not good, or why don't I make some video that make some fun, and make you laugh, and you laugh about it, and if you watch my video and you laugh about it, and that's good, and when things happen and if there's no solution and you worry, and at the moment while you laugh, you forgot all about this and actually bring some good energy for you, right? Stay awesome, and I love you all. I'll try to with my niece. Can you show us more? Yes, I will. Can you tell us what your name? Okay, my name is Szenan-Balance. Szenan-Balance. Okay. Okay. Yeah, I have more trick in it. I'm trying to do all the trick to my daughter. I'll try to film it down. Okay, and the reason I didn't feel her face is because she was on her pajamas. So she said no face and no pajamas. You can tell she was on the pajamas. She asked me just do the hands. Yeah, I respect her. Yeah, you're really great. So much deep thinking about human being for you. That's great. Great. I'm very happy that Kika and Irina has been engaging with me and in Instagram. Yeah, and thank you very much. And stay awesome. And I'll see you tomorrow. See you. Bye bye.